Hello, good evening from St. George. I want to show you a way that you can help reduce lateral hip and knee pain using your foam roller. So first you're going to lie down on your side so that the roller is horizontal, perpendicular to your thigh. You can put your elbow down and put some weight on that outer thigh. The top foot is going to help you lighten how much weight you put on it, because sometimes this IT band, hi, come on in, can be a really sensitive area. So you're going to roll out that side of your thigh called the IT band, and you're just moving back and forth, and you're going to keep good shoulder blade stability here, meaning the shoulder blade is down the back. Now, if this is too easy, you can always lift up that foot and do a little bit of a side plank to put more body weight on that foam roller. Or to make it easier, you can put your foot down and press into this arm more to get more weight onto the roll. You don't want it to hurt, you don't want it to take your breath away, but you want to feel like you're massaging that band. Now you can roll high on the hip as well, because this band crosses the hip and could create lateral hip pain. It almost can make you feel like you have arthritis when it's really tight, or you'll get a clicking when you move your hip on a repetitive activity like sideline leg circles or running or biking. So you can roll out this area from the top of your hip over the greater trochanter, that big bone here, all down the lateral thigh, and you just want to avoid a couple inches from the knee. So just stop 2 inches shy of the knee. Now a neat trick is to go a little bit rotational towards the floor. You're also going to feel that outer quad muscle, the vastus lateralis. And then you can also rotate towards the sky a little bit, and you're going to get that lateral hamstring, the biceps femoris, and that muscle crosses the knee too, so it can influence knee pain when it's really tight. So we're rolling out that side muscle with the IT band and the lateral muscle of the quad and that lateral muscle of the thigh, and all you have to do is you want to keep rolling. Now if you find an especially exquisite point of pain, you can sink into it, breathe. You'll actually feel it start to change. Might take up to 90 seconds. Sometimes you can feel it release a little bit earlier, but that exquisite point of pain is a trigger point, and it's almost like it would take your breath away, or if you were standing, your knees would buckle. That's when you know you're on a good hot spot to stand on. So I also like to get that little front muscle called the TFL, the tensor fascia lata, right here where your front pocket is. So basically, if you're rolling and it feels like it's therapeutic in nature, it's probably going to be good for us. So let's take a moment to switch sides. I like to do a little bilateral inspection. I can tell the side that I've rolled is flatter like a pancake. It's not as tight pulling over my knee and my hip. So let's do the other side, and put your elbow down, get your foam roller out. And just know, sometimes this is an area that won't really tell you it's in pain. It'll tell you, the hip will tell you that it hurts, or the lateral knee will tell you it's tight, but the IT band rarely gives you a signal that it's tight in and of itself. It'll go to a joint. So that's one little trick you can do. Press hard on this arm, shoulder blades down the back. Keep breathing, because it's tempting to hold your breath. And you see I have my bottom foot off the floor, I have my top foot assisting me, but if you've been rolling, you might find that you can take both legs off the floor, and that puts more body weight on the IT band. Now the little trick to get a little more of the areas that could be creating pain around the lateral knee and the lateral hip of the hip is to rotate towards the floor a little bit. And that is getting that lateral quad, that vastus lateralis. And again, I'm making sure not to roll on the knee itself. I'm keeping a couple inches shy. And then you can also roll to where I'm rotating up towards the sky, lateral hamstring. You can feel where you're tight, so you want to give those areas more tension. So right there, I just had a trigger point, and I'm going to breathe, and maybe up to 90 seconds. You can start feeling it change, and then you can keep letting go, and then re-roll again. So I'm going to also make sure to get where the outer hip is. When I used to road bike race, I used to get this left leg's a tiny bit shorter, and I used to get a little bit of a sensitivity at night. Kind of felt like, I guess, arthritis would feel. All I had to do was roll this out a couple minutes before bed, and it'd be free and easy. So you might want to try this lateral roll if you get tightness in your lateral hip, or your lateral knee, especially if you do a repetitive sport like biking, hiking, running, and just see how that feels. That was it. I hope you enjoy. May you have relief from any lateral knee and hip pain, and thank you so much for joining me.